And boom, we're live. This is TikTok Live number 47 now. We just got the first question in the chat. I'm recording this. Guys, this is going to be the podcast on YouTube channel, Spotify, Apple Music. I'm going to put the top five actually. I'm doing the top 5 listeners for the longest time of this podcast on TikTok Live. I'm going to be giving you a shout out in the caption. All right, let's get after it. Let's go. TikTok Live number 47. All right, first, here we go. Adam, hey doc, how can I get higher chances into getting into OMFS? So are you in high school, or are you in college, are you in dental school? If you are in dental school, because that's when you should be worrying about it. I mean, you got to get that CBSC up, you got to get that class ranking, that GPA, you got to get the scores that you need. And then you need to start developing relationships with the oral surgery attendings, the oral surgery residents, get an idea of what oral surgery is like before you do all this, by the way. And then those attendings are going to be writing your letters of recommendation. So hopefully if you do well, and they appreciate you helping out, assisting, working, and they like you, they'll write your letters of recommendation and give you a good idea, give you a good recommendation to those programs, essentially, right? It's that simple. All right. LLC, what's better, Rutgers or NYU for dental school as far as specializing? That's a great question. If I was to compare both of them, NYU and Rutgers, NYU is a lot bigger, almost 3 to 4 times the size as Rutgers, right, each year. And the percentages, they're probably about the same. Rutgers might have, because it's a smaller class size, Rutgers might have a little bit of a higher chance getting into oral surgery. For specializing, I would assume that's also for specializing. NYU has plenty of people that specialize as well. I'd probably go with Rutgers has a better match percentage within the entire class. A better percentage of that goes into specialties. I'm assuming. I don't know. I applied to both schools. I didn't attend either, though. I went to Stony Brook, right? So I could be way off with that, but that's my best guess. All right, let's move on. Tyrese loves cats. What got you into your OMFS program, in your opinion? I think it was personality. It had to do with my application, everything I put on there from my externships experience. I externed at this program and came back like in the height of COVID. So, I mean, that showed dedication. I really tried to get to know the residents, get to know the attendings, see what they're like here, see what the objectives are, how much oral surgery exposure they get. I really appreciated the clinic. And, and I let them know that. I think I connected with certain attendings well enough to get that interview here and then get ranked highly from their end. That's what I think. Neil Patel said, how many OMFS programs did you apply to and how did you choose? So let's see, it was in the middle of COVID and I had found out that a lot of people were applying to OMFS residencies. Like they had already doubled the number within like the first couple of weeks of applications being submitted when I was talking to programs. And so I was like, all right, I'm going to have to up my numbers since everyone out there is generally raising their numbers, right? They're getting more numbers, applicants to the program. So I started at like 20 to 30. I upped that to probably 30 to 40 on the program that you apply to. Okay. How did I choose? I just, I externed at these places and I asked everyone. I asked my older students at dental school. That's a great question. So how do you find out about these oral surgery programs throughout the country? Number one, you have to talk to those older students at your dental school. If you're D2, D3, talk to the D3s and D4s. Ask them how their externships work, okay? Also, when you go on these externships, you find out about the program, but ask those other residents, what other programs did they extern at on their extern trail, okay? Those are the top 3 ways I would say you learn about the programs throughout there, okay? Those are the number 1 ways, because there's also student doctor network, but that's not always so reliable. And you'll see some of these posts, they're so outdated. They're like a couple decades off. When I was applying, I realized that. Okay, so that's something to keep in mind. Let's see, we got, where'd he go? Mahmoud Saifi just got the number 2 gifter badge. Oh, wait. Oh, here we go. Mahmoud Safi. Who should I get letters of recommendation from besides dentists? I'm assuming you said besides dentists. You mean for oral surgery residency? No, I'm assuming you mean for dental school. Try and get them from... No, wait, for dental school, you just need to get recommendations from like your department and like the head chair of your department where they make like that like team recommendation letter. You gotta get that. That's a big one. Ian Mahoney. Brah, intern year is kicking my ass. Any words of encouragement? Yeah, intern year isn't forever. And I know for me, it started like halfway through and it went over halfway into my second year, my PGY 2 year of residency. So yeah, I think as far as encouragement, keeping your head up through intern year, especially as during residency, keep making sure on those days off, your post-call days, or when you have days off on the weekend, make sure you hit those things you need. Whether it's cooking, whether it's exercise, don't forget those things. You got to identify what's that kind of motivating. You have to separate your life from work. In your life side, what are those things that you really look forward to in the day, that you really enjoy doing in a week's time, on the weekend, on that day off? You can't forget about those things, and you need those more than ever during your intern year. That's my word of encouragement. Whatever that may be, it might be drawing, it might be painting, it might be playing the violin. Do those things, okay? Don't forget. I swear, during your intern year, it's going to be very difficult. Many people they drop out during their intern year. Don't do that, okay? Think about those things on your outside day. Talk to your family members. Keep in touch with your friends. Ask them what they would do in your situation when things come up, right? See what they would say. And then, here's another one. Keep in touch with your mentors through dental school, through undergrad, through residency. Keep in touch with them. Talk to them when things get tough, when you have questions. They went through it too. They can tell you their tricks and secrets, okay? Their hacks to getting through, okay? Super important things. Anna Scone LLC, thank you. You got it. Tyrese loves cats. Was the OMFS program at your first choice? It was, yeah. The program at now was my first rank. Second rank was Christiana Care. Excellent oral surgery program. Great hospital, very good culture, friendly people. Then VCU, outstanding experience that those residents get over there at VCU. I know a lot of them still. They're really getting a good, the program directors, the attending, excellent program for oral surgery. I would say one of the top in the Northeast, along with Christiana Care, MedStar, Rutgers. Rutgers changed a little bit, but still I put that on their Montefiore, so those are some of the top OMFS programs I would put on the East Coast and the Northeast. All right. Oh, so what watch do you got on? This is Jack Mason Halyard. It's very affordable. It's a great quality watch, though. I love wearing dive watches, especially ones that are like comfortable and got like a rubber or silicone strap on OR days. And it was almost an OR day today. I'm all gold this weekend. Yeah, that's funny, right? Let's see. So, guys, by the way, this is TikTok Live number 47 now. And the top 5 listeners, I'm going to be giving you guys a shout out in the caption, okay? Glenn Roy said his double jaw surgery of a Fort 1 plus a BSSO, a pretty common OMFS procedure. From an OMFS standpoint, yeah, I mean, that's one of the main surgeries we do, like the big surgeries that no other specialty does in dentistry. So that's probably one of the defining surgeries I would put on oral surgery. Yeah, just from my perspective, that's one of those that defines our specialty. In addition to trauma, IV sedation on top of wisdom teeth, big implant cases, all necks, zygomatics. The IPS case is now becoming a new one where it's subparietal prosthesis. Yeah. So orthognathics is quite common. I mean, as far as common goes, though, how frequent do we do that? It really depends on the referrals from the orthodontics team and OR time. There's a lot that goes into that. User 1222 is 72 EPC/77. After conversion, a good CBSC score. Both those look pretty good. You're saying, I know everyone shoots for 80 plus. What's your knowledge? No, my understanding is shooting for 70 plus. And then if you can get that 75, that's good. And you got a 72 EPC/77. Those are some good scores, man. Those are some good scores. Matthew, I remember you from That Was Epic when he toured your apartment, LOL, and paid your rent. He did pay my rent, and he did tour my cute little adorable apartment right here with all the plants. I have 14 plants. Isn't that hilarious? I don't know. You're asking what gets you through intern year. I love to have a nice, I don't know, something about a plant vibe. I think it really seems like an anti-anxiety vibe. I don't know. Just to me, just for me personally, User 1222, what kind of people who got in? What kind of people that got in? Wait. The numbers of what people that got in? Yeah, I know people, anywhere from probably 60 up until 99 got into, on the CBSC, got into oral surgery residency. Ian Mahoney said, what did Ian say? Ian Mahoney said, oh, wait, you said it again. Okay. User 1238. I'm stuck between PA and dentistry. I know 2 different fields, but why is dentistry better than medicine? That's not necessary. I mean, I consider it better than medicine. I'm looking at all these doctors that I work with, and I shadow doctors, and I think dentistry, I had said it in a recent post, where it kind of affords you, not necessarily financially, affords you a better quality of life. I think because many times there's a private practice feel. It's a very clean profession too. Generally, I mean, yeah, saliva in the mouth is dirty, but as far as the profession itself, I think dentistry is very clean. If that makes sense, you walk into a dentist's office, it's generally pretty clean. But no, so you're asking why dentistry better than medicine? If you look at the dentistry lifestyle and quality of life around the career, you generally get a little bit more time to yourself. You get time with your family. And I think that's, like I said, afforded because you can usually have your own practice in dentistry. Whereas in medicine, you're usually working for an institution, a corporation, a large hospital system, for example, right? And then you work for them. And then they make your hours, they kind of shift around things. You have responsibility to your patients, but you also have responsibility to the institution. When you own your own practice, you have responsibility to your patients and your team, your office, the practice, but it's all that's yours. That's your thing. You could shut the office out at noon if you want. When you work for a hospital, they decide your hours, they decide your salary. Okay, there's a lot of differences between that's one of many. Tyrese Love Cats. Thoughts on all the unmatched OMFS 6-year spots? Yeah, I think it's not good. And I was talking with Dr. Wahan about it, and there was an article put out in the JOMS, and it was saying how it's getting harder and harder to select OMFS applicants. Maybe it's getting more challenging, but hard to pick oral surgery residents. I disagree with that. I really think that that's just an excuse. You need to spend time with residents, no matter what residency it is, no matter what career you're in. You need to spend time with applicants and get to know them. It's not right. Stop judging it based off of one score. You gotta put some time into getting to know these people. And I think that's not what's being done. That's my thing. So I'd be really interested in talking about this further with someone on the other side who does pick candidates, right? And I'd love to see like, okay, so what are you doing? What aren't you doing? Maybe we can mitigate this a little bit. I got ideas. Haley _ Lauren, is that Conan O'Brien? Because of the hair, right? Because my little hair flip. I have like a calyx somewhere over here, and then it goes this way, or however it works. Paul, follow the live creator. Thanks, Paul. Mohammad Safi said, yeah, dental school. Yeah, dental school. I think I answered for it, that right? Yeah. Case management physician. Let's talk about hypertension. Kidding. Yeah, let's talk about hypertension. It was interesting because, everyone assumed that type of blood pressure was elevated plus 80 over plus 30 only due to pain. That's a lot. That's very elevated. Just pain and anxiety? No. First of all, that's very elevated. It's definitely not just pain and anxiety, right? There's some underlying cause to raise your blood pressure that much. On top of that, everyone just assumed the tooth's just in pain, that it was due to infection and stuff, and take the patient out of pain before you do stuff. Like, Pat Monahan. Hey, don't forget Monty. I did mention that. You called me there. What's up, Pat? He just graduated from Montefiore oral surgery, and he's down in North Carolina practicing. So, Patrick Monahan, thanks for coming on, brother. So I was getting to with the hypertension, we all have like our cutoff points, and it's different for every oral surgeon, different for every dentist. But before surgery, like I was saying, you generally want it to be under control. You don't want to be through the roof. And if it is, and if for that rare instance where that patient does have elevated blood pressure solely due to anxiety and maybe dental pain, yeah, then they should probably have a note from the primary care provider so that we could hedge this and we completely are expecting it, so that, in the middle of the procedure, what to expect. If it goes up, it goes down, it goes sideways. There's just so much that goes into it. And really, I was very surprised how many of the medical side of healthcare was just saying like, oh, it's definitely because, no, you don't know, it's definitely because of just tooth pain, and I wasn't referring to just an infection. That's different. You have to tackle that beast when it happens. Yeah. So no, that was really annoying that I just got crushed in the comment section. Everyone commenting that this guy doesn't understand blood pressure. I do understand blood pressure, and when push comes to shove, I'm pretty sure all providers in their chair would consider the same. Like everyone has a cutoff, and you got to stick to those things. All right, let's move on. Tyrese Loves Cats. Do you know anything about the UIC's OMFS program? A little bit. That's the one where I did a podcast with him. I think he's at that program, right? He's also from Aspen Dental. Yeah, and UIC's dental school, they actually have like a Delta Dental sign on the wall, if I remember correctly. But yeah, shoot, wait, pronounce his last name. I forget it. All right, let's move on. Autumn, you give Grey's Anatomy of Dentistry. I give Grey's Anatomy of Dentistry. That's a really funny way to put it. I've never watched Grey's Anatomy. I don't know. I don't like watching hospital or medical shows. I really am not a fan of them, to be honest. Matthew said, "Are you still with your girlfriend?" I am. Gigi Leung, what guidelines do you use for the management of MRONJ? I mean, for the management, well, depending on what stage it is, and then when it really starts to get out of hand, antibiotics, do you need to resect it? A little bit of debridement of the area versus if it's so bad, the mandible could fracture, might need to be resected. But then that needs to be taking place in a hospital setting with someone who manages that. HBO therapy seems to be pretty good. I know there was a recent JOMS article that said it wasn't shown to be as effective as something else, but from our perspective at our program, we manage a lot of MRONJ, and I've seen really good results with HBO therapy. HBO therapy is hyperbaric oxygen, by the way. Yeah, I've seen it done really good things on patients with MRONJ. I have. I've seen it several instances. I forget the amount of dives that they have to do offhand. It's like at least 30 or 50 or something. I forget. Patrick Monahan, no problem. Good seeing you, man. Good seeing you, Pat, brother. Good to see you, man. Matthew said, "Are you?" Yeah, GG Long. Good. T said, "Just got into a 4-year OMFS program." What's up, T? Congrats. That's awesome. Congratulations. 4 years. I'm very biased for 4 years. So congrats, T. Well done. Well done. Tips to prepare before July. Just like see all your friends and family and do what you can to like live your life now. You already went through 4 years of dental school. Do what you would have told yourself to do those few months before dental school. Do those things now before you start oral surgery residency, right? That's literally your advice, right? I think that's the best thing you could do. Becoming Dr. Trey, MD, pre-med, is there a way to reverse demineralization? Yes, there is. I have had it since a child for whatever reason. You got to be brushing. If you're really trying to do that, I would brush probably 3 times a day. Make sure you're using fluoridated toothpaste. That's a big thing. That's what I would, and floss, obviously floss. Floss before you brush your teeth. That's the better time to do it. Juan Real Unal, what would you have done if you had not gotten accepted into OMFS? I probably would have shot for a GPR and then go through GPR and think about reapplying or not. I don't know. It would have depended on how the GPR year would have gone and the opportunities throughout GPR year, what was on the horizon. It would have depended on that. Clifford Allen, what do you think about GPR? I think GPR is good. There's a wide array of different GPR programs and the experiences that you can get from them. So that's something to consider. You want to really try and go to the GPR program and get an idea like what they actually do there, if you can. Okay. Matthew said, "Could you answer my previous questions?" Well, yep. Matt, can you do it one more time? I'm sorry, I missed it. User, can you share more about VCU's program? Yeah, we did a coronal flap one day. It's a 12-hour procedures on a Thursday. Thursday or Friday? It's Thursday. It was a Thursday. Yeah. I remember. Then I went out to eat after that, but there was blood all over the floor in that surgery. It was crazy. It was to repair a posterior palatal defect dehiscence from a cocaine abuser, the patient, and they used the temporalis flap to go through the back of the maxilla and repair the roof of the palate that way. It was incredible. It was one of the biggest and most amazing surgeries I've ever seen, still to this day. And yeah, VCU, excellent. They have like a solely implant specialist that works there, and he's outstanding. They're doing all NX cases every day, every week, maybe every week, I believe. And great program, great instructor, super inspiring. One of the authors of OMFS Secrets, he works there. Abu Bakr. That's him. He's at VCU. And he's excellent. He's the nicest, most humble, down-to-earth guy. He was the one that did the Corona Flap. So, yeah, that's VCU. I only have good things to say about that program. The residents are outstanding. Yeah, so that's VCU. Victoria Costa said, "The dentist left a root in my mouth after extraction. So weird how he did not notice. Was it a wisdom tooth root? Was it like a coronectomy procedure? Because maybe if that's one of the things that he did, that's what we do with the coronectomy. We take the crown off and we leave the roots. So that could potentially have been it." H said, "Any tips to get into dental school?" Yep, I would shadow dentists throughout undergrad. Got to take your DAT, get a good score there. Try and get at least a 21 if you can. Very competitive these days to get into dental school. Shadowing hours, high GPA, preferably if you come to a good school and you do well at that school. Those are some of the things I would suggest to get into dental school. Luke, what's up, man? Luke, incoming D1, said, "Do you know why the OMFS spots were not filled for the institution in your post?" They're mostly 6-year programs. I think all these programs are ranking only their top applicants, and all those top applicants are applying to many more schools throughout the United States, and then they're matching to other programs, and it's going right through the program's list. They're not ranking enough, and yeah, so they're not ranking enough people, and it's all 6-year spots. So that means more people are ranking less the 6-year spots. That's all I could think of. Victoria Casa, back molar, it was one in front of it that left the root. Now I got to go back. Oh, shoot. I'm sorry to hear that, Victoria. I don't know. I'm not sure. I'm not sure what happened there. Luke, incoming D1, I assume they're affiliated with the Cleveland Clinic, which I thought would be a pro. You're talking about Case Western. Yeah. I think they are associated with the Mayo Clinic, if I remember correctly, right? Yeah, it's a great program. You're getting a year discount at Case Western because it's only 5 years and you get your MD. I'm doing 4 years. I don't get my MD. It's one more year. Most programs are 6 years, and those extra 2 years you're getting your MD. It's literally a year discount. It's a year less of your life, and you get that degree. I didn't get an interview. I would have loved to get interviewed by Case. I didn't even get an interview there. It's very competitive, but not good. 2 out of 3 spots go unmatched. H, I'm doing UPenn's summer dental program for undergrads. Is it a good thing? That's a good idea. That's a good thing to do. Yeah. Victoria Costa, it was in the back molar, left M3, they said. So I don't know if that was right. Back molar, left M3. I don't know what M3, like your third molar? That's a wisdom tooth. Maybe they did a coronectomy. I don't know. But you said you're going back and they got to take it out. Okay. Mikey, should I become a surgical tech? If you like what surgical techs do, yeah, why not do it? All right, guys, last question. Then I got to head in. I still have a presentation I got to make for tomorrow. JNYC, do you have to be really good at math to be pre-dental? No, not necessarily good at math, although there is math on the DAT. Remember that. So that's important. Well, it's like a weird math. I don't know. Whatever. Do you need to be really good at math though? Not necessarily. Clifford Allen, I just got accepted into GPR program. Congrats. What do you recommend for the first few months? Dude, yeah, same thing for any residency. Just enjoy life right now. Okay, and then Matthew said, why are you skipping my questions? I have not skipped any questions now. I can tell you that for a fact. Matt, I don't know what's going on. Maybe it's flagging your question because I'm not seeing any questions. I can tell you for a fact I haven't skipped any questions now since you said that. Rihanna Clements, I'm in school to be a surgical tech. Oh, Rihanna, there you go. That's so funny. Someone just asked, recommend being a surgeon, and you're in school to be a surgical tech. That's awesome. Do you have any? I'll wait a second for you, Rihanna. Can you answer our kind friend here who was wondering about your program, your profession, if you can, really quickly. One more question, guys. One more question. But yeah, Clifford Allen, you know what I mean? Definitely take those time to. It's like what you did before dental school. You know what do you wish you had did before dental school? That's going to be the thing that you want to do right now before residency. Okay, like spend that time to get that in whatever it is. Maybe it's just hanging out. Maybe it's catching up with friends and family. Maybe it's traveling a little bit. I want to do all the above in between working and after residency. Matthew, is being an RA good for dental school? Here we go. I see it, Matt. An RA, I'm sure can help because it shows that you had to have some responsibility throughout college. You weren't just out partying and studying. No, you were studying. Maybe you were partying, but you're also responsible for monitoring. You're a hall monitor, right? You're monitoring a dorm, a resident assistant. Is that what the A stands for? Resident something, right? But yeah, it shows responsibility. It shows that you had to be serious about something on top of school during undergrad. Rihanna Clements said, yes, I think it's totally worth it. I'm having so much fun learning all the specialties. Rihanna Clements also said, and what it's like to work with the surgeons. Cool, that does sound fun. So now you're not locked in and working with just one specialty. You get to work with a variety. Oh yeah, look at that. Some comments in this live were filtered to protect the community's experience. Matthew, maybe that's what happened. You see that in the chat there? All right, friends. TikTok live number 47. The top 5 listeners through this episode. I'm going to be giving you guys a shout out in the caption of this podcast I'm recording right now in the background. I'm going to put it on Spotify, Apple Music, YouTube channel. So catch me there. Thanks everyone for joining. All right, guys. You have a good night. Have a great week. I got to go do a presentation quickly and finish my laundry and have dinner and Jesus. All right. Well, all right, guys. Love you guys. Number 47. All right. Good night.